Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we'll be again seeing the glycogen storage disorders. So to recap the first part, storage disorders. So recapping the first part, we saw the G6D, that is a glycogen storage disorder type 0. So this was about the synthase, that is a glycogen synthase. And as we discussed, the symptoms include the hypoglycemia as well as the early death. So hypoglycemia as well as early death. This was in the part 1. Next we look into the G6 type 1A. So GSD type 1, and 1A was nothing but the von Gierke's disease. This was what we had discussed. And this is the defect in the G6P, that is glucose 6 phosphatase. Now to just highlight some important points, we spoke about the accumulation of the glycogen. This leads to the hepatomegaly or the splenomegaly, and this is due to the accumulation of the glycogen. And there can be severe fasting hypoglycemia, and there are two hyper. So what are the two hypers? There is hyperuricemia as well as the lipidemia. Hyperuricemia as well as lipidemia. Next we continue with this part. So we introduce the GSD type 2B. So what is this GSD type, not 2B, it's 1B. So here in type 1B, we spoke that it happens in the endoplasmic reticulum, and it is the G6P transporter which is involved. So G6P we already discussed, G for glucose and P for phosphatase. So G6 phosphate transporter. And next is this is the symptoms are similar, that is they can be hepatosplenomegaly, and they can be severe fasting hypoglycemia, they can be growth failure, as well as lactic acidosis, hyperuricemia and hyperlipidemia. Hyperuricemia and hyperlipidemia. So symptoms are similar to that of the von Gierke's disease. Then there can also be recurrent infections due to the impaired neutrophil function. So it also has an impaired neutrophil function. So there is impaired neutrophil function. So due to the impaired neutrophil function, you have the recurrent infections which is taking place. So you have the recurrent infection which is taking place. Next we move on to the G6 type 2, GSD type 2. So this GSD type 2 is nothing but the Pompey's disease. So G6 type 2 is the Pompey's disease, and this includes the lysosomal alpha 1,4 and alpha 1,6 glucosidase. So it is nothing but the lysosomal alpha 1,4 as well as the alpha 1,6 glucosidase, and that is the acid maltase. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.